Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for neck pain and usually also some combination of arm pain, numbness, or weakness. By the time we're talking about surgery, that means you've already had conservative treatments such as therapy, chiropractic treatments, injections, medications, and none of them really worked. So now you're looking into the next step, which is surgery. The most critical part of surgery decision making is to see if your symptoms correlate with the MRI or CT scan findings. If they do, then your surgery should have a very high success rate and it will be a good option for you. Our goal for surgery is to resolve all your symptoms and get you back to work with full function. So this is a representative MRI of the patient of mine. There's two views that we look at. The first one is the image on the right, which is the sagittal view, which means from the side view. This is where their face is. This is the back of the head, and obviously this is the front of the neck and the back of the neck. In the cervical spine, we have 7 vertebrae. The first one is hard to see because it's just a thin ring. The second, third, fourth, fifth, sixth, and 7 vertebrae are here. The discs are named by the bones above and below them. So this will be the C2-3 disc, C3-4, C4-5, C5-6. And the spinal cord is sitting right behind it. This is where all the nerves are. As you can see in this image, disc herniation at C5-6 is pushing onto the spinal cord and causing an indentation. And that's where you get the symptoms from. The other view to look at is called the axial. That's the image on the left side. What that is basically this line right here, cut and turned so you can look at it from the top. The spinal cord that's over in the middle here is right over here. And the disc is sitting in front of it. You can see this dark area here, that's the disc herniation pushing onto the spinal cord, just like you see over there. This patient presented with bilateral arm symptoms, which means that the disc is pushing on both nerves going out of the spine on both the left and the right. The goal of surgery is to decompress the nerve, meaning get the pressure off the nerve so that there is no more pressure on it, and that way it will return back to function. Because the disc is sitting in front of the spinal cord, the surgery is going to be from the front. So we make an incision in the crease in front of the neck, and we work our way down to the front of the disc. We confirm that level, and then using our special instruments, we remove the entire disc, including specifically that back part that's pushing on the nerves. When we get a full decompression, the nerve should be back in its normal position, but we will also have a hollow space here, and now we have to fill that. The new technology is called a disc replacement. In order to do a disc replacement, we will have to have an implant that acts like a disc, meaning that it can actually perform the cervical motion just like a disc, bending backwards and forward or side to side. It has metal above and below, and then on the inside is usually a metal on metal type of a structure that allows for the movement. When we put this in, then you should be able to have your normal movement of your neck. I should mention that disc replacement is a relatively new procedure. Its counterpart is fusion and plate fixation. This technology has a number of advantages. They include motion preservation, less complications, less pain, returning to work faster, and you don't have to worry about a fusion taking place. So if you're having a routine disc herniation, most likely the best option will be a disc replacement. We save fusions for specific indications only. So what are the risks of cervical surgery? There's risk of bleeding and infection just like any other surgery. Also, we have to push the breathing and swallowing tubes out of the way. So there's a chance of sore throat, difficulty swallowing, and a hoarse voice. The rest of the risks are related to working on and near the nerves in your spine. They include things such as weakness or paralysis, numbness, bowel and bladder dysfunction, spinal fluid leak, and that surgery may not resolve all your symptoms. The risk of all these surgeries is very low, and even if they do occur, the main common ones are difficulty with swallowing and hoarseness, and they resolve after about 4 to 6 weeks. You will typically be discharged home within a few hours from surgery. As for postoperative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery, and we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.